Let's shift gears a bit and move on to the second area that the sources explore. And that's I think it's fair to call it complicated, relationship between stress and addiction. What I found really fascinating in the material you shared is how strongly these two things are connected, almost in a cyclical way.
Absolutely. The research really highlights this two-way street between stress and addiction. On one hand, you have stress, especially significant experiences like, say, childhood trauma or prolonged and repeated stress throughout life. And these increase the likelihood of someone turning to substances and eventually developing an addiction.
And then on the other hand, we have the reality that using substances to cope with stress, well, it doesn't really solve the problem, does it? It actually often makes the stress worse in the long run
Right. And that makes it even harder to quit.
and increases the chances of relapse.
Exactly. It's this vicious cycle.
It really is. And the research specifically points to early life stressors, things like trauma, as making the brain more vulnerable to addiction later in life. Like it actually changes the way our brains develop in terms of emotional regulation and impulse control.
It has a lasting impact. And unfortunately, childhood trauma significantly raises the risk of developing substance use disorders down the line.
It's almost like a programming, in a way, that happens early on that makes us more susceptible.
It's a sensitive period for brain development, for sure. And while trauma is a major factor, it's not the only stressor that can contribute to substance use.
Right, right. The sources also talk about things like financial difficulties.
Yep. Relationship problems, pressure at work, and of course, experiencing traumatic events later in life as well.
And it's often this kind of accumulation, isn't it? It's like stress upon stress upon stress that can kind of push people towards substances as a way to cope or escape.
Absolutely.
Right.
And once someone has started using substances, quitting becomes this monumental challenge, partly because withdrawal itself is stressful, but also because everyday stressors can trigger those intense cravings.
It's like just when you need all your strength to resist, the very thing that you're trying to resist is also making you. So it's like the part of our brain that helps us say no is weakened by the stress that might made us want to use in the first place.
Exactly. It's a double whammy. And to make matters even worse, long-term substance use actually changes the brain's stress response system. So it can become even more sensitive to stress, and that makes withdrawal even more difficult, more stressful. And that can easily lead to relapse, with people turning back to substances just to find some relief from that intense discomfort and anxiety.
So it's almost like the brain gets rewired to rely on the substance to regulate stress.
In a way, yes. And the sources also talk about the dopamine system, which is so central to the experience of pleasure and reward, and really central to addiction.
Right, the dopamine system. Tell us a little more about that.
Well, both stress and addictive substances affect the dopamine system. And that shared influence can lead to what's called cross-sensitization. So think about it this way. Imagine your smoke detector becomes super sensitive after a small fire, so now even a little bit of steam sets it off. Similarly, stress can make your brain's reward system overreact to drugs. And using drugs can make your stress response system super sensitive to everyday pressures. It creates this reinforcing loop that fuels addiction.
It makes sense, but it's also kind of terrifying to think about how deeply ingrained that cycle can become.
This is a complex issue for sure. And given the role that stress plays in addiction, it's understandable that researchers have looked at treatments that try to reduce stress responses.
Right, like maybe some kind of medication that could help.
Exactly. But the thing is, the sources point out that these medications haven't really been consistently successful in clinical trials.
So no magic bullet then.
Not really. And that really highlights the importance of focusing on more holistic stress management strategies as a key part of addiction recovery.
So it's not just about masking the symptoms, it's about addressing the underlying issue.
Exactly. And there are some effective strategies out there.
Yeah, like what are some of the things that the research highlights?
Well, things like therapy, for example. Cognitive behavioral therapy is often very helpful. It helps people identify and change negative thought patterns and behaviors that contribute to stress and substance use. Mindfulness techniques like meditation and yoga can also be really powerful for regulating the body's stress response.
So those are more on the psychological side of things.
Right. And then there's the lifestyle piece. Regular exercise, getting enough sleep, eating a balanced diet, those are all crucial. And of course, strong social support from family, friends, or recovery groups, that's absolutely essential.
It sounds like a really multifaceted approach is needed.
It is. It's about addressing both the psychological and physiological aspects of stress. And the sources even suggest that early intervention could be key.
Early intervention.
Yeah, like identifying individuals who might be at higher risk for chronic stress and giving them the tools and strategies to manage that stress early on. That could potentially prevent substance use disorders from developing later in life.
Really interesting. So it's not just about treatment, it's also about prevention.
Absolutely. And for those who are already struggling with addiction, managing stress effectively is vital for long-term recovery. It's about breaking that cycle.
Right, breaking the cycle.